Have you ever thought about the fact that so many people go to doctors and hear the same thing over and over again? We don't know what's wrong with you, so take this antibiotic and you may start to feel better in about 7 to 10 days. Or, if you have an operation and cut it out, your pain will be alleviated. Yet, so many of these tactics rarely cure what ails them, and they are often left confused and frustrated by the medical community. Nutrition response testing is an alternative healthcare practice that helps people feel physically and mentally better without taking antibiotics or having intrusive medical procedures. This is Dr. Anthony Alfonso and his wife, who is also his assistant, Melissa. Nutrition response testing is a non-invasive way of analyzing a person's body in order to get to the root causes of less than optimal health. When these underlying causes are corrected in a natural and safe manner, the body has the ability to repair itself and begin to achieve and maintain health and well-being. Nutrition response testing is precise and scientific. It is based on the ability to communicate with the body's own innate intelligence through the testing of neurological reflexes. These reflexes are the body's way of indicating how the nervous system is operating. According to Dr. Yulan, in medical practice, there are two key parts: the diagnosis, identifying and or naming the disease or syndrome, and the treatment, drugs, surgery, etc. However, nutrition response testing does not diagnose or treat disease. Instead, it has two parts: the analysis, the assessment of your body's current health status, and the personalized health improvement program, designed clinical nutrition. Furthermore, nutrition response testing works through testing the body's automatic nervous system.
All right, so we're doing nutrition response testing, and we're checking Sam here for specific nutritional deficiencies of what she has. What we do is we push on her arm right here, and we're working right now on her adrenal glands, so it's showing up. So if I go to push on this side, and if the adrenal gland goes a little bit weak, then we start looking for things specifically for her adrenals to help her body function better, so it's in more balance. So we're pushing on the arm, and what this does is a simple way. It's more advanced than what I'm going into, but it's just showing specifically what her body wants for nutrition to help balance her out instead of guessing. So I'll give you an example. If these are the ones that her body is testing for out of all these things that I test for. But if we took something else instead of if she wants this, ask her body if it wants it through the muscle testing. If I put it on her hand, and if we go to push on her arm, see how her arm goes weak. So her body is telling me what it wants and what it doesn't want. It's not me as a doctor telling her what to take. It's not my opinion or my intellect telling her what to do. It's her body communicating through me doing the muscle testing. Okay, that makes sense. Mm-hmm. All right, so so that's the short of it. So what the biggest thing is, we're not treating anything with this. So people come to me, they have we're finding out what specific nutritional deficiencies they have. We're testing them, so we correct the diet, which is more of a paleo diet, which is mostly meats and vegetables, staying away from main things like cakes, cookies, candies, ice cream, sugars, refined foods, processed foods. So you start to stimulate the body to function better and to heal better. We fill in the gaps with the nutrition, and then as a pleasant side effect, symptoms go away. People feel better over time, and the sooner that you can get to people, before they're seriously ill, the better their chance of experiencing good health.
Nutrition response testing analyzes the different areas of a person's body that correspond to the health and flow of energy in each organ. Information is received from the part of the nervous system that regulates the function of each organ. The body's organs provide an accurate assessment of a person's overall health. Dr. Yulan states that each area of the body that gives a response represents a specific organ, tissue, or function, and indicates the effect that energy, or the lack of energy, is having on the body. Instead of using medical tools such as an EKG and electrodes, nutrition response testing uses a practitioner hand to test the muscle of the patient's extended arm. If the organ that is being tested is active, the nervous system responds by reducing the body's energy to extend the arm. The extended arm becomes weak and drops, which indicates that there is an underlying stress adversely affecting the person's health. Once it is determined what area of the body is stressed, a health and nutrition plan is put into place according to a patient's specific needs. Nutrition response testing is a combination with a whole food supplement. Once the body has been analyzed and underlying stress has been determined, the practitioner determines what supplements the patient requires to repair him or herself. This is accomplished through the same muscle testing as described above and is able to be exact on the type and amount of supplement needed. All of the nutrition response supplements are concentrated whole foods that preserve active enzymes and vital parts that replicate nature. Most people today do not have adequate diets that provide them with the nutrition that are necessary for perfect health. There are many vitamins that are marketed and sold to people that are pharmaceutically engineered. These vitamins do not help the body create and maintain health and may sometimes actually harm it. Overall, once people begin a nutrition response health program and abide by the prescribed regimen, they begin to feel better. Because this type of treatment involves getting to the root of the body's disturbances and problems, real and lasting change is possible. One of the most amazing aspects to this health modality is its the ability to hone in on parts of the body that are causing imbalances. The motto of nutrition response is that anything can cause anything. What that means is a simple headache may not have originated in the head. It may have been the result of a kidney imbalance or stress that ultimately affects the head. Even though this method is non-traditional and may seem hard to believe, the results speak for themselves, as many people have been able to get their health restored and go on to live full and productive lives.